There is water. You go to the chief house before you get water. In our church compound, the borehole has spoiled. So we no get water from the church compound again unless the chief's palace.
This is the kind of narrative Water Aid Ghana has been working tirelessly to change, together with other stakeholders. The second phase of the public dialogue on improving access to water, sanitation, and hygiene in healthcare facilities now is a call to action, pricking the conscience of policy makers.
If my wife is going to the hospital to deliver, I expect her to have the full complement of water, sanitation, and hygiene. But a mother in Bongo or Kasina Nankana West is going to the health, in fact, does not want to go to the healthcare facility because there's no water to bath. And let me just refer you to 3 key national documents that talk about this. A national water policy, that everyone should have access to water without discrimination. But we know there's discrimination.
A multifaceted problem, perhaps.
Because we are considered municipality, everybody thinks that we have it all. But that is the situation here. So imagine the chief's compound is there, and the one in Nyokoko, for instance, there's no even electricity in that whole area. So it is quite difficult. Going forward, we should not have a health facility that will not have wash facilities in them.
Dr. Raymond Aborigo of the Navrongo Health Research Center contextualized key findings from a research on wash in healthcare facilities.
Healthcare-associated infections cause about 75% of deaths among neonates born in healthcare facilities in sub-Saharan region. And then most of these deaths, as we know, are preventable if only our health facilities practice appropriate hygiene, have access to water and then sanitation facilities.
Director of Hygiene Promotion, Grace Kafui Anan, touched on the implication of poor access to wash on the provision of quality care.
As we know or we heard earlier on, it's believed that 70% of all diseases can be prevented if we adhere to proper water and sanitation practices, especially the communicable diseases. And for health promotion, we also talk about working in an enabling environment, which means that things must be available to be able to prevent these diseases. Especially, for example, if you come to a hospital with malaria, you don't go back with diarrhea. And if you do not have proper water and sanitation and hygiene facilities, you are likely to have infect somebody with your infection and somebody else infecting you with her infection or his infection. So you can imagine how grave it is not to have water and sanitation facilities available at a place. And for time for health staff to go fetch water also from a distance, it's one factor. If they bring that water, if the water is not running, there's no facility for the water to run through, it's going to be stored, and that water can get contaminated.
So, the big question is, what is the plan of government with regards to the problem? The Ministry of Health received a larger budget in 2019 than 2018. How does the ministry plan to use these funds in light of the challenge? Dr. Winfred Ofosu is the Upper East Regional Director of Health.
The budget part to certainly go into wash activities, but the human resource is also another area. For the emoluments of the staff of Ministry of Health and its agencies. So a lot of the budget will also go into that area. For us to be able to provide comprehensive services that will lead us to universal health coverage.
The forum was on the theme, Leaving No One Behind, water, sanitation and hygiene in all our healthcare facilities now.